Welcome, participants, and thank you for coming from around the world to celebrate World Standards Day. This is an important time to take time to reflect on the importance of standards and really how they benefit in all that we do, in that we work in a common language and to achieve objectives, common objectives wherever we are in the world. So today I'm the moderator. I'm John McGraw, the Executive Vice President of Products and Strategic Offerings at Health Standards Organization. And I welcome you all to talk about this important topic of climate and resiliency as it regards to standards. But first, I just want to do an acknowledgement of our lands. We can have the next slide. Wherever we are, if you take a moment just to celebrate the diverse cultures and communities around the world that we're all working towards healthcare and quality, safety, and resilience for all. So really appreciate the lands that we walk on and where we all come from, and that we all care for the people that we are with and people that are stewards of the land so that we can have a safer world altogether. So thank you very much. So just an overall talk a little bit about our organization at Health Standards Organization and Accreditation Canada. We are an independent group of not-for-profit organizations that are really united by a vision of a safer care and a healthier world. HSO, we develop standards and assessment programs for healthcare quality improvement solutions that have been adopted by over 14,000 sites across 5 continents. And that's really an incredible achievement in terms of we're very proud of. Accreditation Canada itself enables organizations to meet these national and global standards with innovative programs. We customize those for local needs. And we also have the Institute for Quality Management in Healthcare, which focuses on proficiency testing and the laboratory medicine program. Next slide. So overall objective, and I think these are everyone's objectives really, is we would like a safer care and a healthier world for all. We really want to empower people around the world for continuous quality improvement to improve care and for the benefit of everybody. Next slide. So today, we really have a fantastic panel. And this panel is really epitomizing, I think, what everyone would like to do, given that today's focus on standards, we're focused on climate, we're focused on partnerships. These are all critical things. And so today we have a panelist, Judith Eichenbrod. She's the Senior Program Manager for Health Equity and at Health Standards Organization. She leads our interdisciplinary efforts to strengthen healthcare systems and advance quality care. She has a background in First Nations health, environmental science, and public health research. Judith brings a rich blend of expertise and evidence-based decision-making and equity-driven program development. Joining us today from Geneva is Ryan Crowder. He's a learning and sustainability expert, currently serving as the program lead for strategic initiatives at the Geneva Sustainability Center within the International Hospital Federation. He has a rich background spanning the WHO, IAEA, and UNIDO. Ryan brings deep expertise in leadership and education, online learning innovation, and sustainable strategy. I will also add, Ryan is a fellow Canadian who happens to be in Switzerland, so it's a Canadian panel. And Dr. Miles Sargent, he's a family physician an environmental advocate who serves as executive director of the Canadian Coalition for Green Healthcare, leveraging over 25 years experience working with vulnerable populations and leading initiatives that integrate climate action into healthcare systems from Hamilton, Ontario, Canada. And we also have Dr. Bhavini Goel. We're honored to welcome Bhavini, clinical associate professor at the University of Calgary and a leader in hospital medicine and health system transformation. She brings a global perspective of sustainable healthcare through her work with the WHO, Canadian Coalition for Green Healthcare, and her research on low carbon resilient systems. So we're really pleased to have everybody here today. Just before we start and get into this, a couple of housekeeping items. At the bottom of your Zoom screen, you can select your language preference for either English or French. We are offering simultaneous translation with French interpretation of the English presentation. The recording of this webinar will be made available. During the session, please use the chat function on your screen to share insights. Use the QA function to ask specific questions or make suggestions for future areas you may wish for us to cover. So I just wanted to talk a little bit about today's objectives, our background for today before we start off with our speakers. I think really the escalating impacts of changes in the world are no longer peripheral to health systems and act directly on it and healthcare itself. Given that healthcare is about 5% of the greenhouse gas emissions, and that if healthcare were actually a country, it would be the fifth largest country of greenhouse gas emitters in the world. So what is required for a more resilient healthcare system? We have much more extreme weather, floods, secondary effects that cause secondary effects such as supply chain disruptions, large migrations of people in a short time period or a long time period. These events are intensified by the inequities of people. Those with the most inequities or the greatest disparity have some of the largest challenges, and they affect them the most. And along with Canada, healthcare systems worldwide are now facing challenges based on these more extreme weather events, because our infrastructure and systems were designed for decades ago where we didn't see these extreme weather events and activities. So I think healthcare leaders today, and many of you are on the webinar today, are all healthcare leaders. We must kind of move beyond acknowledging these risks. We must evaluate, prepare, partner, and implement it now while keeping patient safety at the forefront. So this all must be considered in a cost containment and workforce shortage world. So how do we do this? These are great challenges. Well, I think the first is collaboration. With so many green healthcare organizations in the world, it's important to focus on collaborating, not competing. I think collaboration and our knowledge, what fits within the greater picture. And really, if we collaborate, we can really obtain similar objectives based on local needs. And I think the second thing really, and primarily why we're having the webinar today is really about standards. In particular, green standards, creating that common language of understanding across cultures, across languages, across practices, communities. But this is really the foundation on which to build. And that's why we're also going to be talking about how green is being embedded in our standards. not just because of green, but because it's putting patients first. And what's also important is process. I think every organization's objectives and resources are different, but the process in which you get there is very important. Just randomly picking out things even may achieve a simple goal, but maybe not your overall goal. And so we're going to talk about that. So just at Accreditation Canada ourselves, we have made our own declaration earlier this, committed to low cost and climate resilient healthcare, integrating green into all of our standards. We've recently announced and piloted a climate action tool. It's a benchmarking tool to help organizations figure out where they are at and also help them make decisions. We have global partnerships. We've been aligning with SDG 17 and international partners to advance sustainable health programs. We have had a partnership with the Canadian Coalition of Green Healthcare on their climate action assessment tool. And today, we will be also announcing collaboration with the Geneva Center, which Ryan will be expanding on he talks. So we believe in climate resilience and the benchmarking tool for healthcare innovation. And we really want to ensure when we look at focusing on climate resilience that we have continuity of service, that we protect equity, and we future-proof for care delivery. So it's about what we can do today, protecting populations at all stages and positions, and looking at that. So together, we can really ensure that the standards and partnerships and innovation we can prepare for health systems for climate change. And we really have a step-by-step guide on how to prepare for that for tomorrow. So starting off with that is Judith. She's going to be talking about standards and how we are focused on patient safety and how green is involved in that. So Judith, over to you.
Thank you, John. I'm really pleased to be joining you all today and providing an overview of how we're embedding climate resiliency into our standards. Next slide, please. So I wanted to begin by highlighting our approach to standards development at HSO to emphasize that the values of safety, equity, and innovation are integrated across our standards and really guide our standard development processes. While today our focus is on climate resiliency and responses to climate change, I really want to talk about how we approach our standards and that this approach shows that these elements are always cross-cutting and interrelated and complementary across the standards. And when we talk about integrating climate resiliency into our standards, we are drawing on these values to do that work. We can't move forward in this space without considering all of these elements together. When we consider the theme of this year's World Standards Day and the focus on Sustainable Development Goal 17 and the importance of partnerships and collaboration, as John spoke to, it's really embedded also in how we approach this work. We focus on partnering with leaders in their fields as well as our patients to ensure that we're developing evidence-based standards that support organizations in providing high-quality, safe patient care. Next slide, please. So with those values in mind, we continue to review and update our standards to reflect the changing health landscape and new challenges, including climate change, to ensure that our standards continue to use the best available evidence and practices to support health and social service organizations in providing the highest quality of care for the populations that they serve. So as we've gone through this process, we are providing contextually specific criteria that provide clear guidance on how organizations can make progress on environmental sustainability and taking into consideration the impacts of climate change as it relates to the topics being discussed within the different standards. So this work has been embedded into two of our core standards, so governance and leadership, to really emphasize the importance of making changes at those strategic and leadership levels of the organizations, recognizing that changes there then trickle down through other elements of the organization and operations. And most recently, we're in the process of finalizing 4 standards for publication that really include context-driven, environmentally sustainable criteria within them. So really focusing in again around what it can be done within those areas to really reduce the impact that they're having, to have them consider how they can be more environmentally sustainable, what kind of considerations they can build into their practices to support not only patient safety, but also the work moving forward. And so we will soon also begin the process of developing a new national standard that includes a focus on climate resiliency. But by having all standards kind of work through this process of reflecting elements of environmental sustainability, we're providing organizations with tools to assess their work in this space and to begin to celebrate their successes and work across the organization in different spaces as they move forward. Briefly, just around the required safety practices. So the RSPs, these are meant to reflect the most important practices that health and social service organizations need to have in place to keep people safe. So items like improving client flow, supporting safe transitions, and really all the RSPs are really have that focus on client safety and care, but really also recognizing that by improving the efficiency of organizations to reach the populations they need, providing patients with high quality care that is timely, that is on target, also reduces the time a patient stays in the hospital and has the associated benefit of reducing their environmental footprint and the unnecessary times in care. It really speaks the idea of that by eliminating practices that do not add value to patient care, we're not only avoiding potential harms associated with overuse of medications, delays in care, but also providing a net benefit to the environment. Next slide, please. So our work to embed climate and environmental sustainability into our standards also aligns with our own accreditation processes. So with the International Society for Quality and Health Care, Principle 6. Principle 6, sustainable care, is around supporting environmental sustainable healthcare and social care, including actions for providers to mitigate their environmental impact and increase their sustainability, along with greater resilience in the face of environmental, climate, and societal stressors. So as we go through the process of renewing our standards, we keep this principle always in mind, and recognizing that it also aligns with actions being taken internationally in this space. Once again, always leading with best practices and ensuring that we're meeting patient needs and keeping patient safety first. Next slide, please. So HSO always works closely with leaders in their field to provide guidance and expertise on the areas in which we work. So our technical committee guides our standards development processes, and our advisory committees provide broader strategic advice to the organization. When HSO began its work in the climate action space, we convened this climate action advisory committee, which has been really integral in providing that expert advice and guidance for the organizations as we build our learning in this space. And one of the key pieces of work they provided advice on was the climate action benchmarking tool that John just spoke to as well. Next slide, please. So we partner with the Canadian Coalition for Green Healthcare, and Miles is here with us today as well. And they've been leading this work on the Green Hospital Scorecard since 2013. And so HSO partnered with the Canadian Coalition to build on this work and develop a benchmarking tool that was based on the scorecard that they've been very successfully using to have a more streamlined version of the original tool available to our clients and to their networks as well. It was introduced on Earth Day 2025 and was piloted over the summer. We had 44 organizations from 63 hospitals from across Canada and Belgium take part. It was designed as a baseline assessment to support all hospitals, and the first iteration of this tool was really well received. Participants really valued the tool as it supported their short and long-term climate roadmaps and enabled conversations on climate across their organizations and helped them position climate as a strategic priority. So as we move forward, we will learn from this pilot and develop a next iteration of this tool while considering its alignment with the work that we do in our standards. So it's always about providing organizations space to have these conversations and providing ways to build one tool into another and to always have the supportive elements forward. And with that, I'll pass it back to John.
Thank you very much, Judith. That's sort of step one. It's really about the foundation and the standards and embedding in all that you are doing. And then when you're looking at the standards, whatever standard they are, green will be a component of it. Even things like deprescribing will be a component of green healthcare. So that's fantastic. So step two, you got to figure out where you're at. And I think Ryan Crowder is going to be talking about how to do that from Geneva. So Ryan, over to you.
Thank you very much, John, and thank you for the kind introduction and the opportunity to be here today to represent the Geneva Sustainability Center, which, as you kindly noted, is an integral part of the International Hospital Federation. I want to begin just to mention very quickly the work we're doing on behalf of the Geneva Sustainability Center, which is really to strengthen leadership capacity around the world to address sustainability among every operational aspect within hospitals. And what's interesting, what we found with working with hospitals around the world is that there's many sustainability aspects already undertaken that are actually usually couched as cost-saving aspects as well. So, for example, energy efficiency, you may be in a hospital that's, of course, moved from incandescent to LED bulbs. You may be looking to reduce energy consumption among some of the machines you're using as well. Water efficiency as well. This may not come as a surprise. Not only does it have cost-saving aspects, but also has a great degree of sustainability aspects to it, of course, as well. And then, of course, we work more into reduction of single-use items, changing of anesthetic gases. But what we find is, again, is it's interesting that hospitals are already often doing a great deal of work on sustainability and just need to continue to work on that in the right direction. So when we talk about sustainability, what's interesting for us is that we're not just speaking about environmental impact. I think that's very important to note. So environmental impact, obviously exceptionally important and a vital component of sustainability, and often where many of the activities and actions are often taken at the beginning. But also we look at health equity and well-being and leadership and governance. So we're going to talk think a little bit later about health equity and well-being and the importance of that within the confines of sustainability, but also leadership and governance. And I understand we're talking to a lot of leaders today, and it's exceptionally important if you are a leader that really sustainability is the impetus to sustainability, the catalyst, or rather the catalytic of it to move forward. It really requires a buy-in at the high level and to move forward on that journey. But as John mentioned, really one of the first steps you need to take is really to find out where you are on your journey, in fact. And there's a couple ways to do that. And really it's about keeping it simple and focusing on the aspects you can control at the beginning and then widening your scope. We really find that there's some wonderful tools that can help you do this. Of course, the Green Scorecard, which is already mentioned, is doing a wonderful job providing an aspect of evaluation on where hospitals are in their journey. In the Geneva Sustainability Center, we've developed a tool called the Sustainability Accelerator Tool, or the SAT. And the idea here is much the same. It really provides a maturity assessment for hospitals to really understand not only where they are in their journey, but also to look at some of the aspects they may not have thought of before. And that goes back to my point before about where some of the activities and some of the aspects of sustainability may already be taken under account, as again under the guise of cost savings, or in fact in other aspects of the organization. But it's very interesting and revelatory for hospitals to start looking at other aspects of sustainability they may not have considered before. And to use a tool such as this really helps along that aspect and really helps you understand more than anything some of the areas and some of the blind spots you may not have considered before. Um, One of the biggest challenges that we find, and something that we've talked a lot about with hospitals around the world, is getting everyone on the same page and really making sure that there's alignment. And using a tool can be very, very helpful to do that. And really more than anything, because it provides a center point of tracking, of reporting, of communication. This is exceptionally important, really, to make sure that not only the leaders in an organization or the key decision makers, but also all staff are really rowing in the same direction. And what's incredibly interesting as well is with hospitals that are just starting on their journey, they're always very surprised about how much interest there is across the hospital to move forward on sustainability, and how there's always been an interest maybe and some activities have taken place maybe informally, but this is a way to formalize that and really make it move forward in concert. Just to mention as well, I mean, it's important not only in the comparison aspect and understanding your performance over time, how you get better, but the aspect of these kind of tools, or to really take a survey of where you are. The exceptionally important point here is not to look at this as a punitive thing, not something to say, oh, we're not doing as well as we'd hoped, or we should have maybe been doing better in certain aspects. That's really not the idea. More than anything, it's a collaborative aspect, and we find that hospitals around the world are really learning from each other and finding that some of the key issues that they're facing are really they've been met or they've been addressed by other hospitals. So we really like to illustrate some of those challenges, and I'll mention a resource which I believe we're going to share in the chat by the end of this call, just to share a little bit more about some of those case studies around the world and some of the problems you may be facing, and how those can be dealt with, and how we found ways to go through that. Um, So really, it's wonderful to work alongside your peers around the world to do that, and that's really what we're trying to do. And I think that leads wonderfully into the collaboration which we're working with HSO and Accreditation Canada, of course, and Canadian Coalition for Green Healthcare. And the idea here has really been to take a regional impact, but it's a global challenge, of course. So we really need to work in concert with each other. And what we've done is we've worked on several key aspects of sustainability, trying to align our practices and find ways that we can really work together and create a universal approach to sustainability and addressing that in healthcare. So I believe, going to share some more detail on this in the next month, and I'll defer to John to maybe discuss it a little bit more. But of course, it is, as I said, it is a global problem, and we want to just make sure that there is alignment. We're very happy with our partnerships and working forward on this journey together. If I could just, add on a couple quick points that I think are exceptionally important. If you take anything from my conversation, and I think that's something, or my discussion here, it's not that we need to necessarily begin with understanding where we are, but also to take action at the same time. So I think both of those things need to happen in parallel. We have noticed, and we have seen a lot of hospitals and organizations around the world that wait quite a long time to do their carbon footprinting, understand where they are on their journey. That's incredibly important and should be done. But at the same time, there's all kinds of small and oftentimes very high impact things that can be done as a very first project towards sustainability that can build momentum very, very quickly and really get you going on your sustainability journey. And again, we've seen some hospitals that have gone from zero work on sustainability, or rather no conscious work on sustainability, and had an enormous amount of improvement and really exceeded expectations in a few years' time just by starting on their journey. And so, as I mentioned before, there's a lot of tools to help you do that depending on your context, whether it be the SAT, whether it be Green Scorecard, whether it be other tools to help you along that journey. But more than anything, it's really to make sure that you can take a confident way forward and to really start to begin to work on some projects that'll have some major return on investment even, so not burden you too much financially, but also have a major contribution to your sustainability portfolio overall. And just to end, I believe, as mentioned, there will be a link provided in the chat. Just to give you some impetus to get started, we have some getting started guides as part of our sustainability toolbox within the Geneva Sustainability Center's website. Of course, feel free to explore that. This is free content that helps you understand what you can do on your journey. And more than anything, I think you'll find some case studies on there that prove that many of the challenges you may have been solved in other contexts, and you learn from those as well. And of course, share back to the community. So thank you very much. A great pleasure being here, and I'll turn over back to John.
Well, thank you very much, Ryan. And in the spirit of collaboration, I think that's great that the HSO and our tool with regard to the Green Scorecard and your tool, we're collaborating on identifying a couple of questions that will help build that international index. And more to come on that. But I think really it's talking about what are the local needs, what tool is best for you, and that I think it's really important that we really work together. So I really appreciate that. So that was really about step 2. I think figuring out where you're at, but also taking action right away. But I think now we're looking at, okay, step 3. You want to take action. You've got a scorecard. What are the options that you have in front of you, and how do you sort of categorize those options of what to do so you can pick something right away or go ahead? So Miles Sargent is going to talk to us about how to think about these options and really how to categorize them. So Miles.
Thank you so much, John, and thanks, Ryan, for joining us today. It's been a great partnership. Next slide, please. So I think several of you have probably seen this already, and for those of you who haven't, this is the low-hanging peach tree we published a few years ago now. Slightly outdated, but for the most part, things remain the same. This is a 200-bed hospital in a Canadian context, and these are the initiatives that you could take potentially at your hospital. Each fruit is an initiative you can take, and we encourage people to go after the big fruits, which are the orange ones, and these have over 100 tons of CO2 equivalent per year if you take these on. The point being, as Brian was saying, yes, we do need to plan. We do need to do our baselining, and sometimes that can take time. And so in the meantime, if you are putting a corporate green team together, we encourage people to go after the big items. They are all important here. Every single one of these is an important item. The yellow ones, slightly smaller impact, green ones even smaller. But you can also see there's a cost scale here on the left. Cost neutral, of course, is at 0. And you run your eyes across there and see all the items which are actually cost saving. And then if you go up higher on the logarithmic scale there, most of these items fall under $10,000. And some of the ones that are higher up, like an energy manager, which at the time we estimated $100,000 salary per year, is a large fruit because the return on investment is less than 1 year. So that energy manager will save you that $100,000 in less than 1 year. So to me, to say that sustainability is expensive is a myth. You can absolutely go after the low-hanging items, save money, and then put some of that money toward other items moving forward. Next slide, please. This is something we published about 1.5 years ago, which looked at, again, Canadian context, looking at the footprint of a day, a patient day in hospital versus in long-term care and home care. On the left is data from BC. They have what are called mixed sites, which are hospitals which also have long-term care beds. And then on the right is data from Laval, Quebec. Quebec's energy grid is over 99% clean, and that's, I think, partly why their numbers are lower. But nonetheless, you can see here in the BC data that a day in hospital for a patient, and this is just scope 1 and 2, this does not include supply chain. Scope 1 and 2, 30 kilograms of CO2 per day. Long-term care was about 9, and home care was less than 2. So this is why we focus on hospitals, and this is why we focus on making hospitals more environmentally sustainable, and we need to do that, no question. However, if you zoom out from here and we zoom out from looking at the big shiny object, which is hospitals, we also consider in our scorecard the system, the way you design your system. And the way we have our system designed right now in Canada, I can speak about Ontario, which is where I live and work. Ontario, 18% of the hospital beds right now are ALC beds. That means alternate level of care, which basically means that the patient has been discharged by social work, nursing, medicine. They've been discharged. They're ready to go to long-term care. They're ready to go home, but there's no place to go. We don't have enough long-term care beds, and our home care system is not robust enough to allow people to go home. So you might argue that our hospitals are becoming parking lots with that number of beds, 18%. And in fact, in Canada now, there are over 3 million patient days per year are ALC days, 3 million patient days per year. Our solution is typically to build bigger hospitals. But I think even more, our solution needs to be making our primary care system more robust and making our home care systems more robust. And I think we need to make that switch. So basically, essentially, this is the patient flow issue. Patients are getting stuck in hospital. We need to work on patient flow. We need to decrease, emerge visits, hospitalizations, length of stay. And there's many, many ways to do this, obviously, with best practices. So best practices align with sustainability. Next slide. This slide is from there's actually the same study. We showed 3 slides. This is one of them, which are essentially about resource use by age. So on the left, we have babies, and on the right, we have people over 90. No one will be surprised by these curves. Resource use goes up with age. This is days in hospital per age group per year. Again, nothing surprising here. I do often ask in my lectures when they're live to raise your hand. Who wants to die in hospital? Who wants to die in long-term care? Who wants to die at home? I've had one or two people put their hand up for long-term care. I've had no one put their hand up for I want to die in hospital. Most people put their hand up for I want to die at home. The point here is that most of this resource use, or a lot of this resource use, is end of life. This is our final year of life. We spend 21 days in hospital. Most Canadians do want to die at home, 87% of us by survey, but over 50% of us end up dying in hospital. And so this is a system problem that we need to address. So I'm going to switch now, and we can stay on the same slide, to vulnerable populations. I have spent most of my career working with vulnerable populations, and certainly when I began my career, we weren't talking, about climate change very much. But I think, as most of us know, and has been alluded to already in this talk, vulnerable populations are most at risk of all our climate change disasters. We, in Canada, the number one cause of death from climate change is heat. In BC alone, during the 2021 heat dome, over 600 people died, which is tragic. Most of them were older adults living at home. Many of them had diagnoses of mental health disease. So the question is, how can we help the most vulnerable? And the solution is not to have bigger hospitals, because we can't all go to the emergency department during a heat wave. How do we support our communities, and how do we make our communities more resilient? That needs to be part of the question. And I will end there and pass back to John. Thank you.
There we go. Thank you, Miles. Really appreciate that. And I think, with the representing the Canadian Coalition for Green Healthcare, talking about, what are all these, what's in front of us? What are the options that we have, and how can we see that there's a return on investment of those options? Because doing a green project does not necessarily cost you more money. It actually has a return on investment, but in some cases within a year. And as Ryan articulated previously, you need to start on something, figure out where you are. We both have these scorecards. And I think finally, what Miles was talking about is patient flow, which is important in everyday care, but also when you have a climate, or having a very extreme event where you have a lot of people come in, flow becomes even more important, because if one part of the system is backed up in normal course of business, when you have an event, it becomes even magnified. So the next step is, you have all these opportunities. How are you going to pick what to do? And when you pick what to do, is it you just pick the first project and you randomly pick the second project? No. Like anything, you got to put a process in place. And when you have a process in place, you can pick a project based on that process, and you can go do the next one. So Bhavini is going to talk to us about how you do that and how successful it can be. Over to you.
Thank you. And thanks to all the participants for joining, and the panelists. And thank you for giving me the opportunity to come and speak here today about the work that we've actually been doing in Alberta. Next slide. So I'm going to talk about sort of what I call against the grain, and Alberta's efforts to move towards a low carbon resilient healthcare system. And I say against the grain because currently, for those in Canada, Alberta is going through a significant refocusing of the healthcare system. And so right now, this is not necessarily a priority, but it's not part of our strategic plan as of yet, because the priority is really refocusing. And I think many healthcare systems across the world have their own different priorities and are going through some sort of issues or some other priorities. So the question for us was, how are we going to do this with the current processes that we have? So what we've really done in Alberta is really look and target the work that we're doing within the current processes or procedures that we have in place. So the work that we were doing was aligning with tackling and targeting some of the competing priorities, which are very different within each province and within countries. So for us, there are many competing priorities in healthcare. Cost efficiency is one, surgical wait time is one, workforce constraints are another one, and flow of patient, which Miles sort of talked about, has become a significant priority for us within our healthcare system. Next slide. So what we did was we recognized we needed an existing process to facilitate mitigation efforts, but that was more at a frontline level and created frontline impact that also tackled some of our competing priorities, but took a significant safety lens as well. And we recognized that quality improvement is embedded in all healthcare system. It was actually the easiest way for us to build these efforts. So in collaboration with the Center for Sustainable Healthcare, we trained myself and one of our QI consultants in the process, and then we embedded it into our current quality improvement process. And what we did was we used their framework. We didn't completely replace our framework. So Alberta Health Services has the Alberta Improvement Way Quality Improvement Framework. And so what we did was we took their framework and embedded it on top of ours. And so using this framework, we then let departments define what their goals and their problems were and put an environmental sustainability lens to it. Next slide. So some of the different examples I'm going to go through. So one of them was by the emergency team. So they wanted to improve efficiency in terms of medication administration. So they looked at a pain medication, and typically they would actually give it in an IV mini bag, but instead they decided to actually push the dose. What they actually noticed was that patient received the pain medication much quicker, and it actually saved a significant amount of carbon footprint, as well as there was significant financial costs. But what was really interesting was the 24 hours of nursing time saved per month. And in a current healthcare system that is really struggling with nursing time, this was a really valuable project. So if you actually spread and scale this across the different hospitals, you are looking at hours and hours of thousands of hours saved over a very short period of time with just one medication. And now you did that with many of the other different drugs that we administer through what we call our IV mini bags. There was a significant amount of hours and time saved. So again, let's think about our competing priorities. This tackled the cost issue. This tackled some of the time constraints for staff, as well as that better flow of patients, because patients weren't stuck to mini poles in emergencies, and you could actually move patients around very easily. So again, we took the competing priority lens, but then also we're like, we can also reduce our carbon footprint. Next slide. Another example recently from our green team competition was the infectious disease team. So they actually looked at isolation, and isolation is particularly significant given sort of our recent COVID pandemic and the ongoing influenza scene that we're seeing. So right now we're going into our respiratory surge in Canada, and that means that we're going to have numerous patients on isolation. And so they looking at something called CT values. So really looking at the infectivity of patients that actually had COVID. And what they realized by doing this simple test that was not expensive, that they actually could reduce the average isolation down to about 3 days per patient, freeing up patient isolation rooms, as well as reducing wait times for beds and allowing flow for actual patients as well. And again, a reduction in carbon footprint. One of the other things that they found was COVID patients are typically given certain medications when they are on oxygen. So we were able to reduce the medication that we were giving as well as the isolation, which led to significant financial savings. And actually, 66% of staff reported that isolation precautions hindered timely care. This ensured better patient care. Patients weren't isolated. We could get up and get them moving and reduce our actual length of stay. Next slide. The next project that we looked at was in surgery, where they actually looked at the reduction of surgical trays. So this was a thoracic procedure that the cardiothoracics did. And what they looked at was reducing the number of surgical trays for this procedure from 3 to 1. Again, significant cost savings here as well, but they actually reduced the OR setup and clean time by at least 27 minutes, which is about 60% of the scheduled procedure duration. So again, when you're looking at, you've got surgical wait times, if you could do this with X number of procedures across multiple hospital sites, then you could actually probably fit in a few more patients into the OR. So you can see how all three projects not only reduce the carbon footprint, not only look at the cost savings, but also tackle some of the competing priorities for a healthcare system and help support resiliency. And so using a simple process of quality improvement, we then started running some of these projects. Next slide. So, this was very much a grassroots movement. So where did we go from this? This actually led to us developing an acute care clinical operational framework. We wanted to see where this work would fit in the broadest sense of a strategy to move towards low carbon resilient healthcare system. And it led to creating a framework. We recognize that we don't yet have a strategic priority within our healthcare system around this work. However, we felt there was a need within clinical operations to actually develop some sort of framework so that we knew what work needed to be done in the different sort of areas of the organization. Next slide. So I recognize this is a very busy slide and I don't want everyone to read these things, and this is available in the paper. But what this framework does is it really aligns with the standards that HSO and accreditation are talking about, mainly looking at clinical operations. And the activities around the circle are executed under certain pillars. So if you see, quality improvement fell within our health and climate research quality improvement and education pillar. So we actually embedded it within that space. And this framework actually sits within the provincial level and has been supported and adopted as a strategy that we need to move towards low carbon resilient clinical operations. And when we started looking at this and building these pillars that have been informed by the WHO framework, we realized that we were actually doing a lot of this work already. So within your organization, you are probably doing things to actually to reduce carbon, but also to build resiliency. So for us, for instance, we've got a virtual hospital at home program that we set up at 2 of our sites within Calgary and also in Edmonton. And so we realized that actually that is a sustainable low carbon model of care. We're also looking at ways of reducing blood draws, reducing our catheterization. So we were already moving towards the Choosing Wisely campaign suggestions as well. We're looking at sort of ethical criteria and incorporating sustainability into our selection of products and services. As well as that, we had started appointing departments, champions as well. So really, when we started looking at this framework, we were like, okay, we're already doing these things, but where are the missing pieces? So many organizations are saying, where do I start and where do I begin? But you're already doing some of this stuff. So, really putting that carbon footprint and looking at it from a resiliency lens is going to be really important. So we started off with something very tangible and we essentially built from there. And that's how we started. And that's how we moved sort of against the grain and aligned with what the priorities of the organization were. So I'll now hand it back over to John. Thank you.
There we go. Thank you very much. I mean, it's really exciting to hear that when you talk about these projects, it's this, you have a framework and you really talked about how even a simple project saves time, nursing time, saves money, it's better patient care. And I think the other piece, really, which I don't think you touched upon, is if you think about reducing the use of mini bags, that's really about simplifying your supply chain. And supply chain, as we know, is a major issue even today in our climate world in terms of um, either supplies being produced or being transported. And we've seen in trade disruptions, we've seen in weather disruptions, whether it's hurricanes, all these things. So that's really fantastic. So just to, I think what you had talked about was step one. It all starts with the standard, shockingly. You look at the standards, and in those standards, it's there. It doesn't matter if it's a climate standard or a patient care standard. All the standards are going to have some sort of green component. And those are the things that you're doing already today. I think the next piece really is from those standards, where are you today? Where are you? What can you do? What are your priorities? And Ryan really covered that off, talking about take a tool. It doesn't matter the tool, take a tool, start. And Miles then talked about once you have that tool, what are the opportunities that are in front of you? And that's even what we're demonstrating ourselves. It's about collaborating with other organizations to see what they've done. We're collaborating ourselves to enable you on this call to be more effective, but it's really finding out what are the opportunities in front of you. And there's so many opportunities. Go back to the standards and look from where that they may arise. And then we heard create a process, and with those process, we heard 3 examples. Those 3 examples together seem, fairly straightforward. These aren't complex examples. Move from mini bag to IV direct push. That's fairly straightforward. You're reducing your supply chain. There's an immediate return on not only on investment, but patient care, and also in time. That is so precious in today's environment, time. And so, once you get there, and we talked about those are all rooted in the standards. See, it all comes back to the standard again. So that's a great virtuous circle. So I really am thankful for walking us through the process and how everything is interrelated. And when they are all interrelated, you get some incredible impact. So I'm actually just going to ask the panel a couple of questions. I think what we talk about here, and we talk about resilience and mitigation. Are they really the same thing? Are they different? But should one come first? And I think mitigation strategies are how to reduce what you have right now. We heard a couple of examples of that, but resilience is also looking at how to harden your systems for future insults. So first, I'll turn to Judith and ask, from a standards perspective, are you differentiating these in the standards, or are these sort of one and the same?
Well, I think when we're looking through the standards in the way that they are right now and looking at the required safety practices as well, there's some pieces in there around looking at procurement and disposal, for example. So how are we, what are we doing with supplies when they're done? How are they being recycled? Is there opportunities for reusing pieces? What does that sort of look like in the process, and building those considerations into the standards and asking organizations to reflect on those pieces as they move through their different, they move through the implementation of those standards. And I think the larger conversation around resiliency really comes to the conversation that Ryan also said, like building up those pieces from the leadership and governance level, and really embedding those pieces into the broader strategic vision of the organization, and letting organizational leaders really figure out what that means for them and how to kind of weave it through the organization so that resiliency becomes kind of part of how the organization moves forward. So I think we're starting to kind of move in both of those spaces, recognizing those changes have to come from different sides, and the new standard we'll be focusing on moving forward is really around building those resiliency pieces into pieces like emergency and disaster management, really kind of having those buffers in place so that the system is able to respond and be flexible and fluid to changing needs and changing environments, and be able to adapt and move forward in a good way.
So Judith, you really talked about how it's up to the individual and up to the leadership and it's up to that. And Ryan, if you think about that, how does your tool help with this and help pick between, thinking about mitigation and resilience?
Well, thanks very much, John. And I can only really emulate what Judith just said, because I think it's exactly the case. I think there's a mutual reinforcement as well to mitigation and resilience, and a lot of the activities you'll undertake as you move forward on your sustainability journey will be aiming to address both. We've seen more and more of the effects of climate change, whether in our local context or worldwide. I'm often using the Canadian example of forest fires, and it was used already today as well in some of the questions. And how that affects our patient populations, and of course our resilience has to be taken into account for that as well. But at the same time, mitigation, in the sense that if we can take under practices that limit the contribution to some of those fundaments that lead into greater calamity within the natural environment, obviously that we should be doing those things as well. And oftentimes those are one and the same. So our recommendation is, in a tool such as ours, or any tool, again, for that matter, helps you explore some of the areas which you may not have considered before, to address those and those aspects. And what we find as well, and I think that Miles put it beautifully in the peach tree, some of the lower hanging fruit of the peach tree, in fact, that some of those aspects can be really addressed quite quickly and immediately start to have a financial impact, and then that starts to to catalyze further action going forward. So those tools can be very, very helpful and revelatory to understand where the aspects, some of the aspects and actions you can take, and then again to build up momentum. And before you know it, mitigation and resilience are being tackled hand in hand.
That's great. And maybe given that we have two tools here, I'm going to talk to Bhavini for a second, just to say, when you're thinking about or discussing with your leadership teams and getting buy-in, is there a difference in discussion and when we talk about mitigation versus resilience of systems? And is there a different perspective that you have to consider?
So I'm a frontline physician and, deal with an extremely large admitting service. And I think, looking at resiliency at frontline is very different when you're having discussions with leadership, I would say. Um, One thing I want to say is mitigation and resiliency go in hand, right? Resiliency is really your ability to withstand shocks and have a healthcare system completely recover or do better. And in actual fact, operational efficiency essentially is center to resiliency. So things like reduction in surgical wait times, patient flow, nursing capacity, all of those things are resiliency. And if you actually go back to our projects, when I'm discussing this with frontline staff, yes, cost savings are important. That is important to leadership. They need to have given room to build that resiliency, which is exactly what Ryan's talking about, is we need the funding to build that resiliency. So that is important to them. But for frontline staff, it's talking about patient flow. It's talking about length of stay of patients. It's talking about time saved for nursing time, all those things. So my discussion with them is very, very different at a frontline level, because I show them that this is actually the areas that we can actually improve efficiency. And so when we presented those projects, the first thing that people said about the COVID isolation, well, we're going into respiratory viral surge. This is going to improve patient flow, and it's going to be better for patients because they're not sitting in a merge, getting confused, waiting for beds. So really, your conversation is going to be different depending on where in the system and who you're having that discussion with.
Well, thank you. And talking about patients that are coming in, I think that one of our last questions of today will be really about health and equity, or equity. And I think looking at climate change and how it amplifies inequities disproportionately, impacting those vulnerable populations, and particularly the under-resourced health systems, how can we address this? So my first question to Judith really is about, when you think about how you're looking at health inequities from a standards perspective, we've talked a lot about how we've embedded green and climate issues disproportionately affect those least capable of dealing with them. How are we thinking about that from a standard perspective and looking at trying to close some of those gaps?
I think it's part of the conversation. I almost don't feel like you can tease one out of the other. And so I think when we are looking at the embedding climate resiliency and environmental sustainability into the standards, we're also within that, asking organizations to consider what that looks like for who's not being served. And so I think the other piece of work that's kind of been going on is around kind of embedding those health equity principles into our standards as well, and really encouraging organizations to consider how to support those organizations those communities that are experiencing inequities, to develop have those conversations, to have those partnerships, and to really identify where those needs are, and to have services that then meet their needs as well, right? And so I think it becomes a bit of a I think it's part of the conversation when you're talking about climate, to really understand who it is that's being most impacted and how you support to have services available that meet their needs, and then also are able to respond to the influx when those do happen, to really pick up and be as supportive and be as present, and as accessible as it can be for those populations that need that care when the time comes, for them to be really being quite, often emergency situations where they're not at home, where they're being asked to evacuate, where they're coming to a health center for that care and support. So I think it really is about always having that lens in mind, and it's something we're doing through our standards process as well, is really embedding those health equity principles within that and having those two pieces walk kind of side to side as part of that work.
And Miles, really building on that, you've spent decades, I think, working closely with some of the, I would say, most vulnerable populations, and you've seen how, from a climate perspective, where you have there's been changes in those populations, and how do you feel that ways of addressing those, either in the leadership and making those most vulnerable, bring that discussion more to the forefront, but also addressing their needs?
Thanks, John, and easy on the decades piece there. Yes, yes. I have worked with inner city populations since the beginning of my career. We won't say when that was. Inner city medicine is now called social medicine. These terms change over time. We did always focus on what we would call vulnerable populations. I think that term is still used. At that time, these populations were vulnerable to lack of housing, vulnerable to lack of health care at all. And I started out working in a clinic which was dedicated to people who were suffering from homelessness and new immigrants and refugees. And the way the system worked is that if you were lucky enough to get into that clinic, hopefully over time, over a period of years, our team, because it was a multidisciplinary team, would help that person find housing, get proper health care, physical health, mental health. That person might, for example, learn English over the next few years, and that person be in a very, very different place 3 to 4 years later if we were doing a good job. But here was the problem. We had a roster of 2,000 patients. And so we ended up having a long list of people on a wait list that could not get healthcare and essentially use the emerge department for healthcare. And I could go into more about why this particular system was broken. Basically, the sickest people were outside on the street, and we were seeing people who are now fairly well. So we changed the system. We called it Shelter Health Network. This is back in 2005. And basically, we saw the patients where they lived, which was typically in a shelter system, and we communicated through an electronic medical record. We had no funding. We were just super keen. We did get funding within a couple of years. So now that system is quite robust. There are 30 clinicians, 25 different sites that we work at, and we've kind of filled that gap. My point is that today you might have a public health system in your city which is doing great work, but it is a massive task to reach every vulnerable person, as we spoke about before, who's living in the top floor of an apartment and is isolated and maybe has mobility or cognition issues. And if there is a heat dome, who is communicating with that person? And so we need community structures And it might be, various Hamilton's a big city. It might be various sectors all around Hamilton creating these networks, which then, become part of the greater system, become tied in with the system, become tied in with public health. But a lot of work needs to be done on the community side. And I hope that's answering your question, John.
I think it really is. And I think really it is about, ultimately it's about community. And healthcare is part of the community. It's the center of it is a cornerstone of the community, but it's not in isolation. And I think a healthcare system is, the stronger a healthcare system is outside of the hospital. I think as you talked about, Miles, reaching out to the community and reaching out to those vulnerable populations, the better we will be. In any part of the world, doesn't matter where you are. And I think what we've all talked about today is the standards is the catalyst and the structure to make that happen. I think what we've all talked about is better patient care. We've all talked about making resources and supplies and time more available for those in greatest of need. So one thing I'd like to say and wrap up in our webinar today is I really appreciate the community that's joined today, this webinar, as well as on the webinar. This is really, again, is about the theme of this year's World Standards Day is about partnership. And it's really about coming together and achieving some common goals and improving healthcare systems and having some mitigation strategies to create greater resiliency so that when people come in, they can get the care that they can have at the appropriate time. I have one, I think to what can you do as a group? Well, I think in general, we've heard today how to approach this. We've heard sort of a step-by-step guide of what you can do to mitigate this and free up resources. You can look at the standards, pick something. You can work on an assessment tool to figure out where you are. You can identify those topics and the projects, and you can select one with a process. And it all starts, again, with the standard and ends with that. And I think it's the important thing is this is all in the achievement of patient care. So step one, sign up to learn more about Health Standards Organization and Accreditation Canada and the journey that you can be on. Take a look at this webinar. We've hopefully arranged it in a step-by-step guide. And also everyone's questions we will look at and incorporate that. But when we're developing standards, we ask for feedback because it's not just about us writing them. These are evidence-based criteria that's written and feedback from the community. So I think what's really important is that this is a community around the world. We're all in it together. We all need to look out for each other. And I think the more we participate and give feedback and give insight, the more we can and share and collaborate, I think the better off we'll be. You've had a number of examples today of small projects having a big impact in one site that can transfer across around the world. So we've come together and brought, I think, some great learnings for all of us. And I appreciate everyone else coming together on the line and to learn today. So thank you very much for all of your time. Goodbye.